Hello everybody and welcome to this extra special session on Christmas Eve. It's how dedicated we are to trying helping you and things. And I'm really happy to introduce Jacob from AccuRx, who's going to talk us through their product, AccuBook, that many of you have heard of and potentially considered using to help manage your COVID vaccination clinics that you're all cracking on with. And I know it's been a challenging time and stuff, but we're hopefully going to show you what it can do, how it can help you, and then try and answer as many of your questions as we can in the time that we've got. How are we doing, Jacob?
Good, thanks a lot for having me, Candy. Nice to see you.
You too. So yeah, tell us about AccuBook then.
Sure. So we started talking to practices right when sort of the rumours were coming out that general practice would be involved in delivering vaccines and looking at ways where we could really streamline it for practices. Obviously, we know they're incredibly busy at the moment. So the things we're really focused on are letting patients self-book, so taking pressure off the phone lines and reception teams. Really easy cross-site collaboration, so with practices joining up across PCNs, making it very easy to share capacity across there, making it really easy to book patients in for their second slots, 21 days later, 28 days later, depending on the vaccine, making sure patients come along well-informed to get their vaccine, making sure you can actually automatically remind patients if they haven't booked and things like that. So we started working on that, went live a few weeks ago in the first practices. And yeah, so far we've been pushing out quite regular improvements. I can show you sort of the rolling release notes. There's lots going out every day, but I've had some really good feedback from the first practices around the speed at which they've been able to fill vaccination sessions. So quite often getting very short notice that they've got 1,000 doses of vaccine arriving that they need to give to their patients and needing to fill up those slots quite fast across multiple sites.
Absolutely. I mean, I know I've heard many of the challenges many practices have faced with either having to suddenly book loads of patients in and actually the opposite as well, having to suddenly cancel because they've had delays with the vaccine delivery. And I can only imagine the stress that must be causing. So yeah, be keen to see how that helps and stuff. Shall we have a look at it? Is that a good place?
Yeah, let's go for it.
All right, so this is the AccuBook system, I think. Talk us through it.
Yes, so where we actually start is outside the product with helping people plan, whether you're using us or not, how many patients to book in each day. So if you've got a delivery of 975 doses coming, how many do you think you're going to get spoiled? How long's the shelf life? And then basically spread out your allocation across the days. So this example, you've got vaccines arriving on day one and starting to vaccinate in the afternoon, and then spreading it out over the next few days. Because the vaccine is such a precious resource, most practices have been telling us they want to optimize for using up every single dose. And so we then let them build in controlled overbooking, so based on the percentage of patients they think either might DNA or might not be eligible when they do attend. And then that gives you a figure of how many patients to book in per hour. So I won't go through this whole spreadsheet, but it's available to anyone to download or to use. And then these are the figures that you really need to plan. So we've tried to get away from the, this patient needs to come before this patient at exactly like 3 minutes past. And what we're really trying to optimize for is having a steady flow of patients throughout a session. So I'll jump over to our product now. As I said, this is just a spreadsheet to help with planning. So a practice using us can either be a delivery site, so they're actually both inviting their patients, but also delivering vaccine sessions, running vaccine sessions, delivering vaccines, or they could just be an inviting site. So they're just inviting their patients. So in this example, this practice I've got up is a delivery site. So they're both running sessions and inviting their patients in. So they can go and set up their vaccination sessions. So where the vaccination is going to take place, quite a lot of the time that isn't the practice address. It might be a local community venue or something. Which other practices are eligible, or their patients are eligible to book in. So they just need to add the ODS codes of those practices. So if they're in a PCM with 5 other practices, they can just put those ODS codes in. and then they can go and set up their sessions that they're actually going to run. So if I want to add, as an example, a session on, we've got one on the 1st of Jan, let's say I want to add one on the 2nd of Jan, I can go and put in that session. And let's say I'm going to start at 8 and I'm going to run it until 1 o'clock so the team can get some lunch. And then based on the calculations before, I know that I need about 35 patients per hour booked in. So that session will have 175 slots for patients to book in. I know it's going to be the Pfizer vaccine I'm getting. And the reason we need to know that is so that we put the right constraint on booking of the next day being 21 days later. And then I need to go and add in the next session. So I've got one on the 2nd of January. Those people are going to need their second dose on the 23rd of January. So I'm just going to go and put that in. And I'm just going to put in the same details for simplicity. So I'm running it from 8 to 1, 35 patients an hour. I've got the same capacity. And then I've got that session up. And you can see there were some other sessions set up before as well. So I need to just make those live, which means patients can book in. And there's a note just asking me to make sure that I've got a second clinic in between 21 and 28 days later. Mm-hmm. And those sessions are now live. So that as a delivery site, that's all I need to do to set things up. I don't need to go and create individual slots or anything like that. I can just set the start and end time and the capacity for people to book in, and obviously invite the other practices. So that's the setup. Then I need to invite my patients. So this could be me as the delivery site, or this could be one of those other practices whose ODS codes I added in. I'm actually going to jump over to our new view here. So there's a toggle at the top, which will just show all patients invited. What I can do is I can add a list of people. So I need to upload a CSV. It's telling me the format. I've got one prepared over here. And what I've done in this CSV is some patients haven't got a phone number, some have a mobile number, and some have a landline number. So you'll see what happens. We've just added in a check where we go and check those numbers on the spine to check that the CSV that's uploading is valid and the rows aren't offset by 1 or anything like that. So it's telling me actually a significant proportion of the numbers in here don't match the PDS record on the spine. Please review. I know I'm expecting that because I'm using dummy data, so it won't match that. But if you're uploading a real list of patients, that shouldn't be there. 2 of the patients I've uploaded have a mobile number, and 7 of the 9 don't. So 3 have a landline and 4 don't have a number. Typically, we'd expect more to have a mobile number. It's just in this demo data that only those 2 don't have. So I can go through, I can edit the message that will go out to patients asking them to book in. I'm gonna leave that as is. We personalize it because to really help with the trust that GP practice has with their patients. The message is coming from their own GP practice that sends these invites. And I'll hit send. So that's now gone out. You can see that it's a list of 9 patients. 2 of them were awaiting reply to book, and 7 of them need to manually book. So I'm going to show you now what a patient sees if they get that text message and they click on their link. So let me go into one of these patients. So you can see this person, all from the pasta family, fettuccine, is awaiting a response. And that means that they've been sent a booking link, but they haven't yet booked in. So if I click on book here, this is what the patient sees. And I'll just put it in a bit more of a mobile view so you can see what they'll see. Right, so this is what the patient sees. Oh, they won't see all that. So they get a screen, so they can go to nhs.uk info to find out more about the vaccine. They can continue and book, or they can decline. So if they decline, we collect a structured reason, like, are they unwell now? Have they got a history of allergies? Do they not want it? Have they had it elsewhere? That goes back to the practice. In the case that they are booking, so we've made the location really clear, because obviously a lot of patients aren't going to their usual GP practice. They need to confirm their date of birth. So the only reason why this date of birth is pre-filled is because I've clicked the link on the staff on the practice end. If the patient receives a link, they'll need to enter that. And that's making sure that if they've got a shared mobile, that we've got the right person, or if the link ends up sort of stray on, that number's been recycled in the network or something like that, there isn't a problem with the wrong person booking in. And there's checks there. So, if it's entered wrong a certain number of times, it blocks them. And then when they go through, we'll show them availability. So there was already a session on the 1st of Jan. You saw me add a session on the 2nd of Jan. There's one on the 5th of Jan. So let's go for one of the ones that I just added in. We don't show every single slot available. And the reason is partly not to sort of overwhelm and confuse patients, but also when you send out an invite, loads of patients are going to get a text at once and going to be trying to book. So we're trying to minimize the number of clashes where two people pick the same time and then are told, oh, actually, you need to go back and pick a different time because it's gone. When this says 8 to 8:10, actually, because we said there are 35 patients per hour, 6 people will be able to pick 8 till 8:10, and 6 people will be able to pick 8:10 to 8:20, and so on, and then 5 people will be able to pick 8:50 to 9, because we spread out the capacity over the hour. So let's go for the first slot in the day. So we hold that slot in the basket so that I don't sort of later find out it's gone. And then we're checking for slots 21 days later. So because I picked something on the 2nd of Jan, it's only showing me the 23rd of Jan. And as I mentioned, we only show sometimes, but if actually I need a different time, I can show more, and I'll see all the times here. So let's say I want to go for 8:30 on that day. So just confirming the details, where the location is, I can go back and change times. I can book in. When I book in, I get a text message to say, here are the dates and times of your appointments, and here's the location. If I don't book in, I get a text the next morning, as long as there's availability, reminding me to book in, and also the morning after, as long as there's availability. And then the day before that clinic, so on the 1st of Jan, I'll get a text message in the morning saying, remember your vaccinations tomorrow, so an appointment reminder. On the practice end, they can then see, right, on that 2nd of January, that session I just created, there's now 1 patient booked in. So that's the patient I just added. I can go in and click and see that. And on the day, I can manage, for example, have they arrived as they go through. But you can see all the list of different sessions that the patient had. You can see who's invited them and what time they're, who's arriving in each time block. So that's a sort of very, very quick overview just of how the booking process works.
Cool. So a couple of questions, if I may then, Jacob. You mentioned obviously when the patient's booking their first slot and then they go through to book their second one.
Yep.
What happens if for some reason the patient just cannot make that second day? So I know you said it had different times on that second day, but does that allow them to book for a clinic that's later on? I'm aware also the guidance is slightly adjusting to potentially make it 28 days universally in preparation for hopefully the other vaccines as well. So obviously there will be that potential shift that happens in the near future. So I guess I'm just inquiring as to how that would work really.
Yeah, of course. So let's say I go through with a different patient and I pick my slot on the 1st of Jan. And I go through, it's only going to show me the 22nd of Jan. And the reason we're only showing you that date and, for example, not the 23rd of Jan, is we don't want to use up those slots for the people who go for the 2nd of Jan. So it's trying to make sure that everyone is able to have their second dose and we don't sort of use up the wrong slots. So they can then go back and then they'll need to pick a different first date. I can't remember what I just picked. So yeah, I just picked the first. So yeah, let's say they actually decide to do the second, they can continue and they'll see the 23rd. If at this stage they realize they want to go back and change, if I go and edit the first slot, it will wipe both of them. I'll be essentially start from scratch. If I go and just edit the second, it will give me availability on that day only. So we try to handle that as much as possible, but without what we really don't want to do is use up loads of second slots for one date, and then there'll be spare capacity for the first date because people can't book in their second.
Yeah, understandable. And as you mentioned, this system also allows the practice to book it for the patient. So for example, if they don't have a mobile device, like you mentioned, obviously there's going to be that list of people where, you know, there needs to be a manual booking and things. I guess one of the questions I've had from other people, what do you do if a patient doesn't have a phone? Is there anything that the AccuBook system can help in terms of managing that, aside from literally grabbing the patient and saying, let's book it with you right now?
So we haven't had any feedback around problems of patients literally just not having a phone, having no way to contact them. We discussed letters with some practices, but what we found is if you send someone a letter, the letter says, please call us up, and you've still got to do a phone call. And actually practices would rather do that on their schedule when they're quieter in the afternoon or they've got a bit more capacity than just having patients call in. And, you know, maybe you send the letter and then all your vaccines capacity has gone and you've got patients calling up. So practices wanted to be in a bit more control. So the manual booking flow is exactly the same one I just showed. It's just the date of birth is pre-filled. So we've tried to make it really fast. If you're, say, a receptionist going through, you just type in the number, hit book, offer the times, and go through. Should also mention on the 21 days, if your second delivery is actually coming 22 days later, we handle that because we actually look in 21 to 28 day window for the first available day, and then work from there. So we do handle that. Although so far, practices seem to, you know, their delivery dates so far are scheduled for 21 days later.
Awesome. So you're going to show us what it looks like in terms of the practice back end. Sorry for interrupting you there, but yeah, you're going to show us that part.
Yeah, no, that's all right. So I've showed the sort of on the day view for the practice, which is, you know, being able to look up for a given day, who's coming at what time. Obviously, hopefully you've got hundreds of patients in there. And that's the nice thing from practice. They've been able to very, very quickly fill a large number of slots. And I think that will only get easier as they move to younger cohorts of patients. For the practice, you can then go through and see, so in this demo practice, these are all the patients that I've invited. I can go and search for a subset of patients, and it comes through. I can go and actually see patients that weren't invited by my practice, but were invited by other practices in the network. So for example, if I'm in like a shared admin hub for the network and I'm doing calling on behalf of multiple practices, I can go through and see that and see who they're invited by. I can go and just filter out, for example, if I want to know only who are the patients to manually book, I can just go and select those and I'll see that subset. So try to create quite a lot of flexibility here. And this just went in, I think yesterday. If I just want to add in one person rather than adding a CSV, I can just put in their NHS number and date of birth and we get their details from the spine. So much simpler than sort of a week ago where you had to go and create a CSV just for that one patient. So that hopefully make things a lot easier. But yeah, every day we've been pushing out quite a lot of new improvements, and we've got you can go and this is sort of public in our Facebook group. We can put it in the show notes, but you can see each day all of the improvements that are going in across different parts of the product. So that example I mentioned of checking the spine to see that you've got good quality data. That example of that new page showing all those details. Every day we're putting in a lot of improvements across the product. We'll keep doing that. I think when the AstraZeneca vaccine is hopefully approved, it's going to change a lot of the constraints and the ways that practices are working, because it's moving from a world of like, right, as soon as that delivery comes, we've got a ticking clock and we need to get through all those doses, especially now practices are starting to use the 6th dose where it's viable, to one of, these are stable in the fridge. Actually, it's much more limited by staff capacity than vaccine capacity. Like that's what you're optimizing for. So I think that will lead to quite a few changes in the system, still supporting both vaccines, but letting you work in that way too.
Cool. And I guess with that, so I know I've had a couple of questions prior to this, which I was going to go through, and I know we're getting some coming through the chat as well. I guess one of the questions I had prior to this was if there was an area that had, for example, 2 separate sites that they were delivering the vaccine from, how easy is it for them to split up the additional clinics, so potentially branch practices? But obviously I know a lot of this is restricted by the designated site element, but obviously some networks are big enough where they've got multiple designated sites.
Yeah.
Does that work? Does it not work? Can you give us an idea?
So currently you need to have one designated site, and then you can have multiple practices. In January, at the beginning of January, we're working on being able to have multiple vaccinating sites, especially as there are more per network. In some areas where they are doing that at the moment, so where for example, there's a federation with 2 delivery sites across 20 practices, what they're doing to start with is saying, right, these 10 practices book in for this one, and these 10 practices book in for this one. In the new year, we want to be able to say, these 20 practices, their patients can book in for either site, so we'll have that flexibility. Some practices are wanting to designate, right, on Monday, we're doing these practice patients, and on Tuesday, we're doing these practice patients. There isn't sort of a formal way to support that at the moment, but the workaround practices are using is basically setting up 2 sites, even though it's the same physical site, where one org is sort of running the Monday and invites the 2 practices, another org is running the Tuesday and invites the other 2 practices. There's a workaround there, and if you've got questions around that, then get in touch with our support chat. We can try and help you find the best setup, but it's something we're looking to add a lot more sort of flexibility in the new year. The focus over the past few weeks has just been make the booking and the sort of inviting and that flow really, really good. And there's still a lot more we want to do. But yeah, we'll be moving to support multiple sites in the new year.
Absolutely, and that sounds amazing, to be honest. The fact that you've managed to get so much of that up and running in literally a couple of weeks, if I remember rightly, from when they started and happened.
It's been a full-on sort of probably about 6 weeks, and the team have done a phenomenal effort. Sort of been working around the clock on it. I think solicited booking, where you're actually inviting people, is probably a lot harder than we originally anticipated in terms of all the edge cases, in terms of someone's booked in 2 doses, but actually they want to cancel their first but not their second, or how many people do I invite so that I don't have any wasted slots, but I also don't have patients clicking on the SMS link and seeing all the slots have gone, and trying to land that sort of jumbo jet on the stamp of getting the number right. So we're starting to analyze the data now for bookings that have happened, what does uptake look like within what time period, and then try and inform the invite flow, because we have had some challenges where practices just send out just invite all their patients, and there isn't enough capacity, and obviously that's not a great patient experience if you've been waiting to hear about a vaccine go on and there's no capacity left. So there is, you still need to coordinate with other practices in your PCN of, right, if we've got 1,000 slots available, how many patients are we each inviting? Because if everyone invites 1,000 patients, you've got 5 practices, then there's going to be a lot of disappointed patients. So that still requires some sort of PCN discussion and planning. And I think we try to get the right balance of being smart and automating things, but not being sort of too smart that it's not flexible. And actually, we want to give this practice a higher allocation because they've got more older patients, or because it's in their practice building and their patients are going to get there more easily, or so we try to get that balance and actually still keep it quite generic and just trust practices to adapt it to their needs.
Sure. So I know we've had quite a few questions coming through the chat, so shall we go to that? So Jamal's, he's asked 2, but his first one was, can I export a list of patient NHS numbers? I'm assuming from the kind of spreadsheet work that you showed us earlier, that kind of has the option of having NHS numbers. Is that correct?
Yeah. So there's I'm on the wrong view. So it depends on where you are. I think the main need that we've seen is around on the day, so you can go and export a list of patients coming on the day, and that has the NHS numbers in, and the times and names. It's worth also mentioning, I think today or over the next few days actually, we've got saving to eMedicine System 1 going in, so where you invite, or also where a patient declined, that going in. So that might I'm not sure, Jamal, what exactly you want to use those NHS numbers for, but if it's putting things back in the record, then that's going in as well. If it's for running Pinnacle and putting, finding a patient in Pinnacle, what we're finding is practices will have us in one tab and Pinnacle in the next, and then on the day they'll go and copy the NHS number and paste it into Pinnacle, sort of as the patients are coming through. We do really want to provide the actual vaccination recording part. We're just waiting on discussions with NHS Digital around that part, so that from here you can go straight into documenting giving a vaccination, and seeing allergies and IMS history for that patient, and sort of a nice, easy to use view. So hopefully we'll have an update in January on where those conversations have got to.
Sure, I'm going to come back to that one actually. Jamal's second question, which may help answer some of the earlier ones, was, and can I export the appointment list for the day in case computer outages? Because I'm aware that sometimes tech, as great as it can be, it can obviously fall down, and we need some ability to work it.
Yep. So you can, this export button here pulls you down the CSV for that session. Each row is a patient with their time slot and their obviously name, date of birth, NHS number. It's also worth saying that all of this, you don't need an HSCN connection. So some sites, staff would bring this up on personal devices. It doesn't store personal data on the device, or on rather like tablets and mobile smartphones and things like that. So even if your main computers for whatever reason are down, it's quite straightforward to then access this.
Cool. Next question I've got is from Ketan. He was asking, so they have a 21-day delivery gap. Can anything be done to stop a patient booking 4 p.m. on the first vaccine, but 8 a.m. for the second vaccine, which will leave them short of the 21-day gap? I mean, my understanding that's by a matter of a few hours, but I can understand why people may get anxious about that with all the weird regulations and everything that obviously are having to be quite stringent.
Yeah. So our understanding of the MHRA and Department of Health sort of licensed medication, it is 21 days, and it's not about sort of that exact time period and number of hours, but is it on day 21 or later than day 21? So yeah, we don't stop you booking 4 p.m. on day on day 0 and 8 a.m. on day 21, because our understanding is clinically that's completely fine. If that changes, then obviously we can build in that constraint, but we're also trying to make sure that there's enough flexibility for patients to minimize DNA rate and maximize uptake, that people can see times that suit them as well. Sure. And if something's only available at 4 p.m. on day 1, that they're not sort of you're not wasting that capacity because someone can't make that or something like that.
Sure. And I guess just to partly help with that, if I remember rightly from all the work I've done looking at supporting patients with the vaccine in terms of information for informed consent, I actually remember it saying somewhere that it technically can be given from day 19, but the reason why they've suggested 21 days is because 3 weeks makes the whole booking side of things so much easier. And as I mentioned, I think there are plans to actually universally take all the vaccines to 28 days. So then you've got the same advice for all the vaccines, because the Pfizer one can be delivered at 28 days and be effective still, according to the drug licensing and MRHA information. So we probably will see that hopefully clarified shortly. But please check the information, because this is off my memory, which is by no means fallible in that respect. So next up, we've got a question from Sophie Crofts. We have multiple vaccinators on the same site, each from a different practice, and would like patients to only book with a clinician from their practice. Is this possible? That sounds interesting.
So, I mean, there's a workaround for doing this. It's not something we'd suggest. I think the main concern with this is it partly. So I agree in terms of continuity of care. It's good, having clinicians that a patient might know. But I think it adds so many constraints to the system, because it means if you've got 5 practices and 200 slots in one day, instead of saying, right, we've got these 200 slots to use up across all the patients, it's actually, right, we've got 40 slots per practice, and we don't want to be in a position where one practice doesn't use all their slots and one practice doesn't have enough. So that's sort of our understanding of the whole reason NHS England has gone for this model, as well as the sort of supply chain and logistics, is actually the more like pooled the queues are of patients, the more efficient the system will be. there is a kind of workaround of each practice setting themselves up as a delivery site and having those in parallel, even though you're working from the same building, which you could do, and you would just like put the capacity for that individual vaccinator, but you then lose a lot of the flexibility. So if that vaccinator is running really late and someone else has capacity, they're going to have to go and switch practice to bring up the list of other patients. So we have built it very much to run in a pooled way where practices from all the patients are seen by all the staff on that day, or could be seen by all the staff on that day. And so far, we haven't really had any feedback of that being an issue. But if you've got other thoughts on sort of ways we might be able to help there, Sophie, then do get in touch. Let us know.
Absolutely. I mean, I can understand why people may potentially want, own practice clinicians to see their own patients. But as you mentioned, it adds a significant logistical challenge when you try and do this kind of mass organization stuff. I can understand the hesitation for wanting to go down that route when how much benefit will it cause? And obviously there's unintended consequences, like you said, of, missed clinic slots. And when you're under a clock to get, this many vaccines done in a short time frame, absolutely you don't want to miss those opportunities. So definitely understand that.
Hopefully, so one thing we have been very keen on is individual practices being able to invite their own patients and prioritize their own, because they know who's housebound, who's going to be able to attend, who might be higher risk, so beyond just the age criteria, and really put that control in the hands of practices. We're looking at ability to sort of add in extra notes as well. So you could say, all right, this patient might be attending in a wheelchair, or extra information, they don't speak English, things like that on the day that might be really helpful to know, and then that comes through the booking notes. I don't know where that sort of is on the priority list, but hopefully in January we'll get to that.
Sure. I'm going to skip the next one and come back to it, but next on the list I've got Azar Siddiq. So is there a screening process that the patients have to click yes/no to on the message before being able to book the appointment, i.e. any COVID symptoms positive test in the 4 weeks before the appointment?
So not currently. We've looked at this. The main problem we hit is, so if every patient fills it in, great, you've got this information. But actually, when we said to practices, what do you want to do with all the patients that haven't filled it in? Do you still want them to attend? Are you going to call them all up? Like, that's going to be quite tricky to make sure happens. And so we haven't included it at the moment. Some practices are putting a bit more information in the text that goes out, saying if you meet X criteria, like don't come in. And I think that's something, again, we'll look at improving in the new year is that flow. We've also spoken a bit less around sort of COVID symptoms and, might that patient be, symptomatic or living with someone who's, COVID positive, or living with someone who's COVID positive, but actually around validity of sort of eligibility. So history of anaphylaxis, pregnancy, breastfeeding, like collecting that sort of information before. So that's something we've looked at. Again, it goes back to the sort of, that's not going to replace doing proper consent, because just because the patients tick that, you're still going to ask as a clinician, like, have you, do you meet any of these contraindications? And what are you going to do for the patients who doesn't have it, don't have it? So we're looking at it. I know some practices have sort of implemented parts of that, and found it helpful, but a lot of it depends on having good patient uptake. So yeah, we'll see. Sort of, we're learning a lot from the early sites around what will help there as well.
Cool. So Jez has asked or commented a few things. In particular, he said, can you talk a little bit about engaging our social prescribing teams to help with booking patients, some of whom have an NHS address but not connected to a particular practice?
Yep. So definitely sort of you can get your social prescribers set up and inviting patients who don't have a phone, or speaking to patients who haven't responded, or things like that. We do need to know sort of which users are able to go in and see patient data and use the system. So those NHS addresses do need to be associated with your practice or a practice in that network of practices. Where you join up the ODS codes, needs to be in one of those practices. Otherwise, we can't just have sort of a public list that you can go and give to people for obvious IG and privacy reasons. It's quite straightforward to add a user. The easiest way is if they're using chain if you get them set up on AccuRx desktop in the practice with EMIS, with System 1, Vision, then they'll be able to, they'll be in a user there and you can approve them. There is a slightly more manual flow where you can contact our support team with their email address and we can add them to that organization. But that sort of is a bit more involved, but we can support in either case if you want to get new users added on so that they can help.
Cool. And I guess from my knowledge, because I want to make sure I don't miss this, for patients that potentially don't have their own registered address but are registered with the practice, I'm simply thinking of those that are homeless, for example, or that kind of thing, it will still kind of work, won't it? It's not necessarily based on the patient having a physical address. It's just being registered at the practice. Is that correct?
Yeah, absolutely. We don't need a physical address. The only one thing we need is an NHS number. Okay. Don't need a phone number. Obviously, if we've got a mobile number, we can send them booking messages and confirmation messages and appointment reminders. But as long as we've got an NHS number, that's the unique identifier. That's also what NHS England has said needs to be used in the recording of vaccinations as well, so they can track things all the way through. So they'll have that through being registered with a practice. You can invite patients or add patients in that sort of ad hoc ad view I showed you who aren't registered at your practice or any other practices in the network. So if you've got, for example, members of staff who you want to vaccinate and you still want to book in, you can also do that. You can do that, but you do need their NHS number.
Cool. And you mentioned earlier about you're looking into supporting the documentation side of the vaccination. So Pinnacle is obviously the system that many places are having to use outside of London, and I've already forgotten the name of the one they're using in London, but it's something.
It was going to be Sonar, but actually London is using Pinnacle as well. So
there we go.
For care delivery.
Given obviously the massively amazing turnaround you guys have had with just sorting out booking, I mean, can you give us any sneak peeks, any kind of spoilers, shall we say, in terms of what might be coming in terms of helping practices with the documentation side of the vaccination process?
Yeah, sure. We're honestly not hiding much. We're waiting on clarity on the specification for NHS Digital on what's required, like basically how does the data flow into different parts of the system. We've gone for a very simple workflow from that book list, click record vaccination, and then sort of very simple questions. You don't need to, we can persist the staff member's name who's vaccinating, can persist the batch details as you're going through. Try to really simplify that. Also, we show allergies and immunization history from EMIS, from System 1. So you have to sort of go and look that up, but it's like in front of you as you're recording vaccinations as well. So we're just waiting on, hopefully at the beginning of Jan, we'll have a clearer picture from NHS England if that's going to be a route. Currently it's, Pinnacle's the only option, but we do really want to help there, because ultimately, if I don't know how long practices are finding takes to record each vaccination, but if it's 5 minutes and we can get it down to 2 minutes, then actually scaled up across delivering 1,000 vaccines, that's a huge time saving for staff, and also a better patient experience, and get better flow through the building, and ultimately vaccinate the population faster.
Awesome. I mean, that sounds great when hopefully we can have that available, and I'm pretty sure I'm going to be suggesting to Jacob that maybe we can share that when that happens as well. So hopefully everyone that's watching this and all the other EGP learners watching this afterwards can see that as well. I know we have more questions, so I'm going to go back to those, if that's all right, Jacob. So where were we? Here we are, from Stuart Hall. So what code will be used when we import back to clinical system to show that an invite has been sent or an appointment has been booked?
So I don't know the SNOMED code off the top of my head, but I know there is a SNOMED code for SARS-CoV-2 vaccination invitation sent, or maybe it's invitation sent by SMS. I can't remember, but I can go and look that up. But there is a specific code for this that we are using, and cool. Likewise for declined as well. There's a few different declined statuses. We just added in yesterday getting a structured declined reason. So rather than just I don't want the vaccine, maybe I'm unwell now, maybe I've got a history of anaphylaxis to other vaccines. Maybe I don't want it. One thing that came up quite a lot, sort of on day, I think it was the first or second day that practices started sending out invites, was lots of patients saying, I want it, just not now because I'm unwell, or I want some more people to have it first. So letting us capture for the practice that sort of information.
Cool. And I know Ravi's asked about having access to the Excel spreadsheet you showed at the start. As you mentioned, we can stick the link for that in the show notes. So if you check back in about an hour or so, I'll be able to add that in. If not, I'm pretty sure it's somewhere on your AccuRx website, isn't it?
It's definitely on our Facebook user group. I don't know if it's on the website. It's in our sort of update emails we sent to users. But yeah, let's put it in the show notes. We're going to update it later today just to also add in a factor for now that practices can use the 6th dose, their estimated sort of proportion of vials that will give them a 6th dose. So some practices have said all but 2 vials they managed to get 6 doses out of. Some have said 75% of vials they managed to get 6 doses out. So basically putting in a figure there and using that to actually being able to uplift capacity, which in some senses is sort of even a bigger ask for practices, because you're not trying to get through 1,000 vaccinations in 3 days. You're trying to get through 1,200 vaccinations in 3 days. But I think we've seen from practices amazingly determined to not let any of that go to waste, and vaccinate as many of their patients as possible. So I'm going to add that into the model later today.
Awesome. So yeah, we'll stick that in the show notes. If you are watching us live, feel free to check back later on, hopefully today or the latest tomorrow. And that should be available. If you're watching on the recorded, hopefully you'll be seeing that down below in the show notes and stuff, and that'll be on the YouTube version of this. So if you're watching us on Facebook, just track over to the YouTube link and things. Interestingly, Stuart's gone and helped us with the code. So apparently that's the SNOMED code that you're talking about. So we've got it there, which is awesome. I know.
I wasn't far off with the description, I think.
No, you weren't.
Do the number.
Obviously, with all this work that's been going on and stuff, it's been really, really challenging. I think one of the other questions people have had is about how can they start using this system? What process do they have to go to? Because whilst many of the sites are potentially already up and running, obviously post the next couple of days with the bank holiday weekend and stuff, there's hopefully going to be a lot more sites, because obviously people were hesitant to fully get up and running before, so then they didn't have the clash with the bank holidays. If people are thinking about this, where do they need to go? What do they need to do? And how does it work from the payment perspective? Because I know that was a bit of an issue at the start, wasn't it?
Yes. So the good news is that there is national funding for AccuBook for the booking side of things from NHS England. This Google form we'll put in the we can put in the show notes as well, if that's all right. And that's basically where practices just go and put in which organization they represent. So it could be a PCN, it could be CCG, it could be their federation. And then when they go through, they'll be asked for the ODS codes of the practices. And that's the information we need to get set up. The software is funded directly from NHS England. The SMS costs you need to pay or will invoice you for. And then there is a route to reclaim those back from NHS England. So they've created a fund for SMS costs, but they can't pay us for those directly. So basically by agreeing to this, you are agreeing to paying the SMS costs. There's some more details of what those are. People want a really exact number of what that will be. Unfortunately, we can't give that because it depends on, not just how many patients you invite, but also how many have mobile numbers, how long are the messages that you send. If you go and cancel a whole session and send people cancellation notifications, then go and rebook that session again, you're going to be sending loads of extra messages. So we've estimated it as around the sort of 18 pence per patient, but there is that central funding to cover it. So yeah, if you go through this form, we'll get you set up as soon as possible. It's normally in a couple of hours. It might take a bit longer over the next few days with Christmas and New Year, and especially if lots of practices are ramping up. So please be patient with our support team because I think they're going to be stretched across quite a lot of practices if struggling. But we are trying to, every practice that gets in touch, get them set up as soon as possible so they can get their patients vaccinated.
I mean, I think the fact that your initial leading time is a couple of days, I think you said, wasn't it? Or was it a couple of
hours?
couple of hours. Okay, even more amazing, a couple of hours to get people on board. I mean, that alone sounds amazing. So, you know, yeah, don't think you guys need to kind of say anything more than that, to be honest. And absolutely worthwhile that you guys got our EGP Learning Innovation Tankard Award, which, if those who are watching us now haven't seen that episode, feel free to go back and look at it. Probably no surprise to most people that, you know, AccuRx pretty much got the award for the most innovative company from our perspective, mine and Andy's. So I just wanted to sneak that in because I wanted to also slightly embarrass you on camera for that one. Yeah.
Thank you, Gary. No, we were very humbled, and it was going around our team Slack on Saturday with a lot of excitement. So no, thank you for that. And yes, it like continues to be a privilege to help GP practices who are working so hard through, even before COVID, but particularly this year, to be able to help them look after their patients more safely, more efficiently, things like that. And lots of exciting things planned for next year as well.
Awesome. I'm just going to sneak one tiny little question because it is related to stuff you just mentioned before we wrap up. So Stuart's asked, for the standard message that's set up at Invite, how many segments does it use? Any ideas?
I think it's one. Yeah, it is one fragment, actually. It's one fragment. Obviously, if you make it longer, it's more.
Absolutely. And I guess the last thing I wanted to chuck in there is that I'm not sure if you can see the comments, Jacob, but the amount of comments that we've had throughout this in terms of, just support for the work that you guys are doing is pretty impressive. I must admit, I'm just flicking a few of them across there and stuff. And yeah, absolutely appreciation for the work that you guys have been doing to try and help primary care just tackle this immense thing that's happening right now. And then, yeah, from myself as well, very much appreciate the work that you guys have been putting in. And thank you for joining us on Christmas Eve to showcase this as well, talk about dedication and commitment and stuff. So absolutely, thank you for that.
Hey, thanks for having us, and thanks so much everyone for the kind words and for all the hard work general practice is doing to vaccinate the population. So yeah, it's only a privilege to be able to help.
Cool. So everybody, thank you for joining us. We're going to wrap up now. As I said, check back in a couple of hours if you want all the links and stuff. We'll make sure they're up and available for you. And we'll probably be doing something fairly similar again in a few weeks' time once we've got more information. And I'm guessing the AstraZeneca, once hopefully it is approved, will add more complications and therefore more stuff that we need to showcase in terms of what we need to do. Thank you again, Jacob, for your time. I really appreciated it. Hope you have a nice break over the next couple of days. Definitely deserve it with everything that you and your team have been churning out for us. So again, thank you for that.
Thanks so much for having us. And yeah, thanks for all the support this year as well.
No problems. And EGP learners, as always, we're here to help save you and your patients time by taking hands to your primary care and learning. And we'll catch you in the next episode. Ta-ra.
Take care.